Thank you very much, everyone, for coming. And I want to thank first the foundation for their support, for giving me the opportunity and providing me with a safe space to share my research with you. And then we can, I hope you enjoy the session. It's an interactive session. Feel free to ask me a question anytime, interrupt anytime, just raise your hand and ask your question. I'm fluent in English and Arabic, just in case you need either. So I'm happy to provide both. So yeah, again, thank you very much. And I'll start with the title. My name is Amad, and thank you very much again for coming. And did you all get into Padlet? It's a platform where you can communicate with me. Ask me a question. It appears here. I think it also appears in your in front of you in the platform which you're using. In case you're not, you didn't bring your mobile, you're not fond of the technology, you can use the paper and pen in front of you and just pass it over to me. And by the way, the Padlet is anonymous, so no names, no identities, nothing's there. Thank you. Access check is, can everyone hear me? Can everyone see me? Are you comfortable? If you need anything, please, just send me a message or just reach out, and I'm happy to accommodate any requirement you need. Thank you very much, Dr. Tiffany, has provided us with a printed version of the lecture. Oh, thank you. Yeah. So just feel free to take one, and you can, share it with others, just in case you need to see it. Okay. Thank you. Thank you very much. Okay. So, first event. How are the energy levels? How are you doing? Where are you within what you can see? Some might be at number 1. It's been a long day, or number 2, or number 5. You're juggling a number of tasks. Just put your answer there. Choose any number. Choose any number you want, and then that's okay. Choose any number you want. Just I want to see how the energy levels are and how are you doing. Okay? Yep. We have a 5, 4, 3. Perfect. Okay. Yeah. Good. Let the answers come in. سجل على البادلت. اي يطلع على البادلت. بس سوي له سكان لهذا. سوي له سكان. one touch. سووا سكان للبادلت. موجود على المحاضرة، أو أقدر أرجع لكم إياه، أخذوا صورة إليه. هذا عماد, AMAD. That's the Padlet. You can just scan it. Scan the picture. Because this gives us a platform to communicate. The password is Amad, my first name, with a small a. AMAD. دخلت؟ تمام. تمام. دخلتي على تمام؟ اوكي. دخلت؟ مضبوط. دخلتوا يا شباب؟ Okay, so everyone's in. Perfect. Okay. Now, it's an afternoon. I want you to enjoy the session. What's the purpose of today's, lecture or presentation or session? I would like you to see, can you understand the role of clinical training and how it's shaping pharmacy practice, pharmacy education? That's the first requirement. One simple thing, can you understand it? Then, can you recognize the benefit of clinical training? Why are we doing clinical training? And then, hopefully, the last thing, can we synthesize together how should it be done, or ought to be done, or share your views, because this is a safe space and it's open for discussion. So that's the objective. I'll start with introductions, definitions. I'll go very big, very wide, very broad. Then I'll narrow it down to Western model. Then I will talk about the UAE experience. So let's start. My journey started in Iraq, where I practiced. I got my first PhD. I moved into Dubai. In Dubai, or in the UAE, I learned how to teach in front of a diverse set of students in a big classroom. And the first classroom I entered, I had more than 40 different nationalities, ethnic backgrounds. Wow, that was a learning experience for me, and this continued. Also, in the UAE and in my experience with Raqqa HSU, I learned student-centered methodologies, team-based learning, problem-based learning, and we'll talk about them in a moment. And that experience also evolved until now, throughout the other countries. Then I moved into Toronto. In Toronto, I realized, or I started realizing the benefit of clinical training for an individual like me, a person with color, going to a Western society. I practiced, I'm an educator, then I took an airplane and went into Toronto, and the situation changed. And when you apply for a position or to get your license, their clinical training is an essential part in order for you to pass and go forward. My paper on that topic explains, I compared 4 countries and how clinical training is essential for people like me, just taking an airplane from different parts of the world and landing in a Western country, and what they will face and what they will, what challenges they will face. So a second paper is coming out, hopefully soon, where I compared 4 provinces in Canada, explaining how licensing procedures are, or what is required from international pharmacists like me, coming from all around the world, and especially Canada. Especially in Canada, more than 150 different nationalities and ethnic backgrounds. So it's a huge, diverse society and community. So over there, clinical training and its importance. Then I moved to the UK, and then I got the privilege of comparing, so, or using this duality concept, because in Toronto I'm a student, in the UK I'm a faculty. So I look at things from different angles. Also, I was working here. I had the privilege of working here for 10 years. So I know this is a country which I'm grateful for, and at the same time, I'm looking at the same country from the outside. When I'm in Toronto, I look at the UAE. I'm from the UK, I look at the UAE and see. So this duality, for me, is very important, because it gives me a sight in order to understand both views, and then I can communicate. 1. Number 2, my focus is to link pharmacy practice, pharmacy education, and policy. And that's my focus and target. Okay, so why am I here? What's my project about? It's to explore how systems are running of clinical training, what challenges are there in the UAE. And in order to set up clinical training, well, we'll talk about it in a moment. Clinical training is happening here, and a very advanced level with huge amount of resources and coordination and efforts, which I'm really proud of. That's what I'm looking at, and also to see what challenges are there. How is it being, or how are these clinical training mandates being processed? So this will fill in the gap in the literature. There's very few articles out there discussing these three aspects: pharmacy education, pharmacy practice, and policy. And also, at the end, hopefully I will be able to give a recommendation to policymakers, educators, about how can we move forward, and what's happening now, and how can we move forward. So my research question, basically, now the UAE has adopted the North American model for clinical training in pharmacy education. It's been implemented. So what are the current policies, procedures governing clinical training? And uniquely in the UAE, we have Emirates level and we have the federal level. So I'm looking at both. And this is the thing which I'm really, really proud of, is how it advanced and changed over the number of years since we started until now, and how it's going to progress for the future. Okay. Now take a moment, read the definitions, take your time. Are you happy with the definitions? Each definition comes from a body. Are you happy with the definition? Do you want to add anything? Do you agree? Do you disagree? Look at the definitions. Read them. Take your time. International Pharmaceutical Federation, they did a conference just a couple of years back in Abu Dhabi. Pharmaceutical Society of Australia, that's their opinion about a pharmacist. And NHS, National Health Services England, that's their opinion about a clinical pharmacist. These are definitions, global definitions by recognized international bodies talking about pharmacists, which I am passionate about. Because I believe a pharmacist is a public figure, highly accessible, and by the way, this is everywhere in the world, highly accessible, highly, highly knowledgeable, and a pharmacist gives a number of decisions every day with every single patient. So I'm really proud of being a pharmacist, and I'm proud of my fellow colleagues. Now, the message which I'm trying to convey, and it's out there in the literature, it's out there in the profession, that the role of pharmacist has changed, has shifted. Before 10, 15 years, even 10 years, it was drug-centered. So when you go to a pharmacist, they will tell you, take the Panadol. You have to take the Panadol. You can take it 3 times a day. You have to take 2 tablets. It's about the drug-centered. But now it's changed, it's shifted. The focus is on the patient, it's on you, not on the drug. So, I mean, American Pharmaceutical Association, pharmacy practice is increasingly shifting from a dispensing and counseling to providing patient-centered. So it's now, I go to the patient and then I say, are you comfortable by taking Panadol? Would you like to take Panadol? I can offer you another thing. Advil, for instance. So it's now I'm talking to the patient. Will you be taking Panadol? Are you sure you're going to take it? Take it on a full stomach so it won't hurt you or disturb your stomach. So it's now about the patient. So now you're more, or the pharmacist is more of a clinician. And we'll talk about that term in a moment. And the other thing which they've mentioned there, team-based care across a variety, that's the interprofessional or multidisciplinary team. A pharmacist now has a job and responsibility within a team. Within a team. Okay. So a question for you guys. What does society need from a pharmacist? Choose any one or other and specify. You can put it on the platform. What do you feel? I'm going to come back to this question later on, but what do you feel? Do you want a dispenser? Do you want a clinician? A clinician means someone caring about you, not just transferring a medicine from A to B. So specify. شنو؟ ما اسمع. السؤال ها أنت بس جاوب. عاد. هاي. اكتب السؤال جواب. ها بس دوسي الصفر. جاوبي يس. You just have to, there's a yellow button. Just press the yellow button and submit your answer. Is it manageable? Perfect. تمام؟ شنو؟
ما عرفت أدخله.
شنو هو؟ لا
دخلنا صفحة غريبة دقيقة.
لا أدخله مرة ثانية هيان اكتب الجواب. You good? You good? Perfect. How are you doing, Dr. Tiffany? Oh, perfect. Okay, yes, perfect. I'd like to be a professional. Yes. That give me info on each medicine, including yes, thank you. Perfect. Dispenser and a clinician. Yes, thank you. Is more accessible. Yes. Yep. Both. Perfect. Yep. We're on the same page. Okay. So thank you. Yeah. And I'll come back to this. Now, we talked broad. Now let's go slightly, I'll be more, let's go narrower, or let me give you an example about the Western pharmacy model. The Western pharmacy model is based on 3 pillars. The professions, professional associations, related to pharmacy, of course, and then regulatory authority, either if it's on the profession side or on the education side, and academia. And these 3 bodies are in communication with each other, and constantly in communication. And it takes time. Just to give you a sense of how it takes time, first conversations about the PharmD program was in California, 1959, until it materialized somewhere and the pharmacists could dispense in America somewhere in the 70s. Until they, and when I say they, the American model took a final decision on the PharmD program between 2003, 2006. Then by that time, the UK picked up, and in 2014, Canada started. So it takes time. Just to give you an example of how many associations are there and how are they linked together, and each one, what do they do. Accreditation Council for Pharmacy Education, they're responsible for standards and guidelines. The professional program for doctor in pharmacy degree. Canadian Pharmacist Association, they talk about the Doctor of Pharmacy degree as an entry level to practice and what is related to that. National Association of Pharmacy Regulatory Authorities, and again, they're responsible for professional competencies, and I'll talk about competencies in a moment. And then the Canadian Council for Accreditation of Pharmacy Programs, which is responsible for the accreditation standards. So there are a lot of bodies involved in communication, in dialogue with each other in order to produce some of these items. Competency framework. So to some of you who don't know what a competency framework is, it's a description of a characteristic or of a certain amount of jobs which a profession or a pharmacist can demonstrate. In other sense, I put it in a different analogy. It's a 3-dimensional request. You have to have certain knowledge, certain skill, and certain attitude in order to perform a competency. So that's what they design. And then when they decide about the competency framework, they set up the training required to accomplish this competency framework and what qualifications do they need. And when they're setting up the competencies, they will decide the professional standards. So for instance, how would you greet a patient? How will you advise a patient or educate a patient? How will you conduct your daily duties? So that's what they that's what they set up. And of course, and this is the important thing, after all of this is accomplished, or nothing of this is accomplished, unless legislation. So they provide the law in order to accomplish these professional standards and competencies. Without legislation, you can't do it. And that's something which I really focus on. Now, the words which they use, and when I say they, the different bodies around the world, you can see they use dispense, compound, sell, administer, prescribe, and perform certain points of care. Are you familiar with these terms? What do you feel?
Not all of them.
Not all of them, right? Yeah.
Selling is special.
Selling, you see? So that's the thing. They've introduced certain terms, and these terms have professional standards with them. They've gone further now, and they've extended the scope of practice. So, for instance, in the UK, since 2006, a pharmacist can be an independent prescriber. So you go inside, you can ask the pharmacist about a certain condition, and they can give you a medicine, they can give you a full session as an independent prescriber. The program which I'm in the UK, we give advanced clinical practice degree to healthcare professionals. For instance, a nurse comes into our program, 3 years, they become an advanced clinical practitioner. So the nurse can sit instead of the doctor and prescribe, give, and attend the patient. In Canada recently, they've given authority to the pharmacist to treat these diseases. Pick and choose which one you are comfortable with, you know them, you will go to a pharmacist and ask, so they are licensed to do this. When I say licensed, they are authorized. The legislation is there. So this is what's happening in Canada. America is also as an independent prescriber and other roles and responsibilities. Okay, so the conclusion here, clinical training is shaped by number of bodies, and through how do they shape it? They shape it in order to fit these roles and responsibilities which the pharmacist has. Okay, how am I doing about time? Good? Okay. Now, UAE case. Look at the timeline. This is innovation. This is a very, very interesting case. Ministry of Higher Education, 1976. Look at the development. UAE University, Higher Colleges of Technology, and then, of course, the pharmacy schools have different names, different titles. You can search them separately, but I'm just pointing out when they were first established. And Commission of Academic Accreditation, CAA. These guys are doing a fantastic job in the UAE, providing license to the universities and to the pharmacy programs, specifically based on high international standards. And we'll talk about it in a moment. Now, the change happened 2015, 2017, when strategies for innovation and national strategy for higher education has been produced. That's the changing point which took the clinical training in the UAE in a different dimension, in a different direction, and towards a highly different level of competence. We have approximately, and please don't quote me for this because there are other programs, but I'm talking about the ones which I can see. In Abu Dhabi, we have one. Al-Ain University has a pharmacy program in Abu Dhabi and Al-Ain. Fatma College has also 2 branches in Al-Ain and in Abu Dhabi. We have one in Dubai Pharmacy College. We have 2 in Ajman Pharmacy College and the GMC Pharmacy College. We have one in Sharjah. We have one in Ras Al Khaimah. So, and they have now a good 15, more than 15, some of them 20, 25 years of highly competent reputation and working. One of the interesting things which I look at also is gender. Some of the schools are just for female, others the mixed gender. So I look at these things very closely, and very, very interesting things come out, and I'm really proud of it. Okay, so what are the degrees which the colleges give? Some call it a BPharm, some call it a Bachelor of Science in Pharmacy, and recently now introduced in the UAE, the PharmD, which is a Doctor of Pharmacy. Also, the pharmacy colleges produce MPharm, clinical pharmacy, MPharm in clinical pharmacy, and that's also running for the past, to the best of my knowledge, more than 10, 15 years now. And postgraduate residency training offered by Cleveland Clinic in Abu Dhabi and Dubai Health Authority. There are other programs for 2 years. One program is in UAE University, giving a PharmD, very interesting program. I hope I'm going there. So there are other programs. I'm hearing also in higher technology, there's one program giving a Bachelor in Pharmacy in Dubai, and again, amazing and work and level of competence. UAE in 2019 produced UAE Professional Pharmacy Graduate Competency Framework. All the pharmacy colleges participated in under the supervision of the CAA, and of course a huge amount of effort. Consultants, international consultants were involved, and they produced the competency framework, and based on that, when I say they, the profession and the pharmacy schools work on. Clinical training, is it happening in our school? It was happening, it is happening, and it will continue to happen. Is it evolving? Yes, it is. Is it in the right direction? Yes. Different models, different names across the pharmacy schools in the UAE. Also, number of hours, number of credits, depends on each pharmacy school. And also, the clinical training is being assessed. And this is one of my focus areas. How is it being assessed? By whom it's being assessed? Is it validated? For how long it's validated? And I continue going on with the assessment, because even if I graduate the student and the student is working perfect, I would like to ask the workplace, how is my product doing? And then when someone will ask, well, why do you want that? Because that's related into international ranking, and tomorrow when we are pursuing international recognition, which we're doing now, these questions will pop up. Licensing, highly organized, and we have 3 bodies: Ministry of Health for the Northern Emirates, we have Dubai Health Authority and Abu Dhabi Health Authority, and each one has its specific regulations to the best of my understanding. And if anyone can add on and help me on this, it's 6 months training before you can get your license if you are a graduate here, right? Correct? Perfect. And then 2 years if your degree is outside. Come on in, come on in, come on in, come on in. Thank you. Come on in, have a seat. So licensing is there, highly organized, and everything is online, and it's going on. Accreditation, this is another focus area for me. As I said, CAA, Commission of Academic Accreditation in the Ministry of Education, they are looking at the licenses and accreditation standards for all our educational programs in higher education, and also about the pharmacy schools. Recently, 2020, they have an agreement with the North American Accreditation Council for Pharmacy Education, which is the ACPE. ACPE, the first program to be given accreditation was 2015, I recall, in Al-Ain. So this is the changing way, or the milestone towards clinical training in a more advanced role. The pharmacist now after the introduction of the ACP accreditation, the pharmacists graduating from our pharmacy schools more clinically oriented. So what is the addition of the ACP accreditation? The pharmacy curriculum is now more clinically oriented. So the pharmacists will graduate in a more clinical role. So they will be able to improve patient care. And once we've got the CAA accreditation and we have accreditation by the Accreditation Council for Pharmacy Education in the United States, so we have improved the quality of our program, and that is a legitimate reason to put us on the global map. So now you know why. You remember when I started what were the objectives of today's lecture. Number 2, is there a benefit of clinical training? Yes, there is, because you will improve patient care and you will put the program on the international map. And I think this is something unique. So a question to you, everyone. If I have a daughter, will I send my daughter to a recognized, accredited pharmacy program, or will I send my daughter to a pharmacy college which has 100 years of history? You can answer me on the Padlet. You can answer me on the Padlet. Padlet. Just record this. Then you can go inside. There's a Wi-Fi also. So take a moment, look at the question. For instance, I'll give you an example. I'm from Iraq originally. So should I send my daughter to here, Raqam HSU, which is accredited by 2 highly international accredited programs, or should I send her to Baghdad? Baghdad University Pharmacy College is 1932. And my colleagues there are doing an amazing job in terms of publication, in terms of training. So I leave the answer to you. That's right. We have to have these dialogues. It's a safe space. So I want you to share your opinion. That's why. Or you can write anything else.
But this is what you are saying, like in Baghdad, it depends whether they are updated. I mean, every year they are...
They haven't been accredited by the ACP.
No problem. If they are updated by the... Yeah.
Then you have to check. You have to check. So what are the answers? International is more developed right now and it will continue developing. Yes, I agree. International, because it will have achievement and experiences, yes. Others such as advisors and caretakers, yes. Yep, these are the questions. Keep them coming. Yep, keep them coming. The board is open. You can send them to me. I will look at it. Yep. International. Thank you. Okay. 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 How am I doing about time? Good? Okay. Okay. Now, last section. My initial findings. I've done interviews. My initial findings with the majority of who I interviewed. I asked them, or my findings are 2. I won't tell you too much of my findings. I'll just tell you 2. The first one, which was very important for me, is the definition. How do you define clinical training? What does it mean within this context? When I say within this context, within the UAE. So the participants agreed on the following terms, and you look at them closely. I've put them in bold. The pharmacy student is in a clinical setting. Clinical setting means in a hospital, in a community, dealing with direct patient care. Okay? Everyone who I interviewed used the word practice. So if you don't mind, keep that word with you. I will come back to it. They used the word practice. Curriculum is there, highly organized, highly developed, highly written. Under the supervision of a preceptor. Preceptor means an individual who will monitor our students. And in fact, our pharmacy programs are so advanced, they have two preceptors, one from the university side and one from the hospital side or the community side. And then it's all assessed. And again, I told you about assessment. I like the word assessment. I will follow it up because this needs validation, it needs checks, it needs a sustainable process. And when I asked my colleagues, they meet the preceptors in the hospital and in the academia. They train them how to evaluate our students. And when I'm looking at the literature, this is coming out in terms of research, heavily vetted. So, like I said, we're doing an amazing job. Now, this is my first definition. So that's my first finding. So that's the definition of clinical training. The second one, I'm using now a football analogy. And please forgive me if anyone's a supporter of any other. I love all the clubs. I'm a football fan, so that's why I'm using the analogy. My second finding is the following. We have the clinical site and the football pitch. Look how beautiful it is. We have the curriculum and the plan, correct? Curriculum, plan. Play on the right, play on the left, correct? We have the preceptors. The referees are there. Now, when they go inside the clinical setting, when I say they, I mean our pharmacy students, they are taught how to do this procedure, how to do this transfer, this information. They are taught so many things. I've gone through the curriculums, and some of the colleges, just to let you know, when you go to their website, they say this is the old curriculum, which some of our students are going through. And this is the current curriculum, which some of our students are going through. And this is next year's curriculum, because we're following a different model. And that's amazing, really amazing. Anyway, so they're teaching our students how to pass the ball. And at the end, they are assessing our students. So thank you. So 2 words I want you to talk about. Practicing and passing the ball. So when I say practicing, do you pass the ball, or do you observe some other person passing the ball? Both. Good. Just observe. So now this is my question. What's the difference?
Difference when you pass, that means you get experience.
Uh-huh.
When you are watching, just only seeing.
Just seeing.
Just seeing.
So now, if you kindly can use the Padlet, what's the difference between observation and hands-on training? But why?
Observation is theoretical.
Theoretical only.
Theoretical only.
But hands-on,
Passing it is practical.
practical.
Yes.
I need you. I need you. So use the Padlet. Just, freely answer me there. Because this is puzzling me. And I'll tell you now in a moment why. Is it observational or is it hands-on? Hands-on means you're doing it. If observational, you're just looking at it. So is there a difference, by the way? There is. Take your time. There is a difference between theory and practice. Okay. Just, would you like hands-on training or observational? Hands-on. Hands-on.
Policy, are they competent to do the practice with their students?
Perfect. So are they competent to do when they are students? Yep, that's a good question. That's a valid question. So my point here, take your time, still write, still continue writing because I'm almost finished. I'm just following what Dr. Bumindra mentioned. Now, should clinical training be observational or hands-on? Now, but there is an important point which Dr. Bhumendra mentioned. What's the law? The law, I looked into it, says observational. Now, we have to follow the law. I'm the number one who has to follow the law because I'm doing this. Under the observation. Perfect. So what I will ask you now, and this conclusion number 3 is limitation, future expectation. If, this is the point which I'm trying to make. We've exported the model of clinical training from outside, right? Over there, the student is allowed to practice as per their law. But, so that's why it's a safe space. In my opinion, what I'm advocating for, we should look into it. When I say we, all the people who are concerned, the regulatory authorities, the profession, the academia, should have a discussion on this point. Because I can't decide, but I've pointed it out. Because you're importing a model, and then the student is observing. Now, there's a history behind this. The pharmacy schools in this part of the world, their curriculum was aligned with the British model. So what does that say? The British model gives you 4 years of MPharm and then a pre-registry year where you can practice as a pre-register year. And then you get your license. But now we're shifting to a different model. So when we're exporting that different model, the student, when you look at the curriculums, 16 credit hours, that means 1 semester. Some of them 32 hours, that means 2 semesters, that's 1 year. Going to the hospital, coming back, huge amount of infrastructure, a huge amount of work being done, but it is observational, which is fine because we have to follow the law. But would we like to put it in a more interactive session or in more hands-on training? It's not for me to decide.
Maybe Dr. Ahmad, clinical training can be like in the phase-wise.
Huh.
In the phase 1, just the observational. Maybe once they have sufficient knowledge and training,
Okay.
they can go on the hands-on.
Perfect.
Maybe the second phase maybe.
So who will decide, do they have sufficient knowledge? And who will decide they will go to the other stage? That's why the conversation is between academia, regulatory authority, under the umbrella of who is ever involved or responsible for this, especially Ministry of Higher Education, Ministry of Education, and Ministry of Health, and the health authorities, because at the end of the day, I have to follow the law. So I leave you with this. This is one. One last thing I want to take your opinion about. We talked about hands-on and observational. Okay, I agree with that. I told you about the story about how our model was more of a UK-based than a North American-based, correct? Now, my last thing and last interaction. Are we ready as a society, as a community, to give the pharmacist a clinician role or a dispenser role? Correct? I mean, yeah, but is society, because that means so many things. Once you have, because this question is not my invention. This question has been asked decades back. Do we need a dispenser? Then we'll have an individual, we'll give him a diploma of 2 years to transfer the medicine from one place to another. Why 4 years and 5 years and huge amount of infrastructure, a huge amount of resources? So when you've put all that resources, you want a pharmacist, right? So the pharmacist, you just want them to be a dispenser? After all this effort which everyone's done? So if you want them a clinician, before you want them a clinician, hang on, let's see society. So do you agree on this point, or yeah? You like it? Yeah. What do you feel, guys? Do you like it?
Absolutely.
No? You don't want society to point it out?
No, absolutely.
They have to point it out, right? Okay, Dr. Bumindra. Yeah. Yeah, correct.
Many countries, they already practice, the pharmacists, they even administer injections.
Uh-huh.
Prescribe, yeah.
But again, if society is not ready for that, for instance, to the best of my knowledge, the COVID pandemic and what we went through, everyone, I mean, in the UK, and that's in the literature, you can double check it, they wouldn't have done the injections if the pharmacists were not there. Even America. Even in Toronto. I did all my jabs in Toronto. I went to the pharmacy, and they were all pharmacy students. They were all pharmacy students. I did all my jabs. They were all pharmacy students. They were all of them. And I really was, they said, yep, the pharmacist in charge, of course. The pharmacist in charge was at the back, supervising everything. But who gave me the injection was a pharmacy student. So these are my references. Again, I would like to thank Sheikh Saqar bin Saud, Sheikh Saud bin Saqar Al-Qasimi Foundation for their help and support in the organization, and for sure, you can email me if you need anything. I will be here. You guys were amazing. Thank you very much.
One second.
Okay.
So I feel like we're on a high note, Jamal. So before we close everything up,
You said 5 o'clock.
look, you can't leave us here because I'm on the edge of my seat. Who has questions?
Okay.
There's a lot of discussion that, some good things are coming to our mind.
Yeah.
Really critical questions, and especially in the context of where we are, you all are in the classroom. You're engaging with the students. Some of you are students. What's on your mind? Let's just take about maybe 10 minutes.
Yeah, I'm happy. Okay, perfect.
Dr. Al-Azzawi is here. We can
Yep.
continue the conversation. So anything on your mind?
Questions, discussion points. What did you like? What do you think? I can go back. Specifically about this point. Do you agree about the clinical site? Yes? We agree about, yes.
You said in the beginning of the lecture that you are seeing here the training, and you are comparing with UK and Toronto University and Toronto. So what's your suggestion? What is we cannot say the drawback here. What area of improvement in clinical practice in UAE when you are comparing to the international clinical practice?
That will come in my recommendations. And that's what I just mentioned a moment ago. And I will emphasize it on it again. No one person or one institute can decide, especially a difficult topic like this, because there's a huge amount of resources, there's a huge amount of structure going on. My recommendation would be all parties involved under the umbrella of the health authorities, Ministry of Health, should sit together and start talking and developing ideas. Because there's an important point which we all have to follow, is the law. So we have to, and that's the point which I mentioned before when I said legislation. So you have to think this backwards. Where is the law? Where do we stand from the law? And how can we go back to make the clinical training hands-on? So you have to involve, in my opinion, academia, because, academia is teaching. You have to involve the regulatory bodies because they know what to do. And you have to have an umbrella to work upon because you need guidance. This is where we go. You have to have a vision and mission. And that's the umbrella which we have to work on. So my recommendation would be, part of my recommendations would be, for this program, we need to sit together, and the dialogue is not one meeting, and the dialogue is not one committee. It's a number of dialogues, a number of committees, and again, when you look at the literature, I told you, in North America, they said, okay, 2003, that's it, we're going to do a PharmD. After 20 years of discussion. And then until they took the final decision, 2006. So this doesn't happen day and night. It doesn't happen in a month or in one talk on one committee or one. It happens over time. And again, I think the question which I asked, is society ready, will play an important part in how to shape these things. Yeah. Questions?
All right. On behalf, I think the most significant thing about this talk, you all, is many of the findings and suggestions that you're talking about, Dr. Ahmad, is about policy. And here we are at the Sheikh Saud bin Sagar Al-Qasimi Foundation, goodness, for policy research. So I think it's very significant. On behalf of the foundation, I'd like to thank
Oh,
you.
thank you.
And if you all could welcome, join me in a round of applause.
Thank you. Thank you very much. Thank you. Thank you. Thank you very much. Thank you. I appreciate it. Thank you.
Now, although it may not be
Thank
a
you.
public group discussion, we do invite all of you all to stick around. We have juice, tea, shawarma,
Oh.
finger foods to encourage you all to stick around, collaborate, talk more. Maybe there are some research topics that can continue to be inquired into. Maybe someone's going to apply for one of our grants soon, and then we can take this into policy and up to making it a law. So there's so many ideas that
Yep.
can be
Yep.
brought together.
Yep. One last thing. I have a paper note this time. If you allow me, it's 3 questions, no names, nothing. Just how did the session go? So what did you learn today? Oh, you're very helpful. Thank you. This last one is spoiled. But just what did you learn? What did you like? How can we improve? Anything, you're free. You can leave it blank. We'll collect it after. So thank you very much again, everyone. Thank you.
All right.